Hello, everyone. My name is Dr. Brett Wilson-Staffko. I'm the manager of harm reduction and health services at Homes First here in Toronto. And today I'm going to provide you with a very brief overview of drugs, the drug war, and harm reduction. So, what are drugs? So, drugs are psychoactive substances that have an effect on a person's perception, mood, feelings, thoughts, or behaviors. Drugs can be either legal or illegal, and they can be obtained in a variety of ways, either as a prescription from a physician, purchased over the counter at a store, bought from an LCBO beer store or wine rack here in Ontario, served at restaurants or bars, or purchased from the illicit market. So it's important to understand that drugs can be both beneficial and harmful depending on their specific properties and how they're being used. A good example is morphine, which is designated as an essential medicine by the World Health Organization because it's a highly effective painkiller for acute pain. However, it's also used by some chronically to numb emotional pain as well. So it's important to understand that no drug is inherently good or inherently bad, and that all come with risks, including the legal ones. So why do people use drugs? Well, there's a number of reasons. Some use drugs to relax, some just to have fun, others to increase their acuity, for instance, with Adderall for when you're studying for a big test. Others use drugs to numb emotional pain as well as physical pain. And so you can see not everyone's using all of these drugs for the same reasons. Here's a list of some common recreational drugs. Now, some are legal and some are illegal. And so we'd assume that those that cause the most harm are those that are illegal, right? Well, let's see. So Dr. David Nutt and his colleagues in 2010 over in the UK looked at a variety of drugs, both legal and illegal, to see the harm caused to people who use that drug and the harm caused to others by the use of that drug. And so in this graph right here, you can see that alcohol overall causes the most harm to people in society, and tobacco is kind of in the middle. Now, when we do this for other drugs, particularly illicit drugs, you see that, drugs such as heroin and crack cocaine and methamphetamine are causing some harm for sure, but not as much as alcohol. But then you have other drugs such as ecstasy and LSD and magic mushrooms that are all the way at the other end, causing very little harm to the people who use them and to society as a whole, yet they are illegal. So essentially, the legal framework that we have is not shaped by the amount of harm that drugs cause to individuals or to society. Legal drugs are what cost society the most. So if it's not shaped by the amount of harm caused, then maybe it's due to the economic impact on society. But when we do this breakdown in Canada, legal drugs are responsible for more economic cost to society than the illicit ones. Legal drugs cost society about $33 billion, and illicit drugs only $16 billion. So it doesn't seem like it's the cost either that is dictating which drugs are legal and which are illegal. So again, to put this further into perspective, 78% of Canadians drink alcohol, even though it causes the most amount of harm to individuals and society, as well as the largest amount of societal economic cost. Alcohol is the leading cause of preventable death, disability, accidents, and social problems. Alcohol is also responsible for about 18,000 deaths per year. Tobacco, which is also legal, kills around 48,000 people a year in Canada, while opioids kill around 7,300 people a year here in Canada. Furthermore, alcohol and tobacco are responsible for 89% of healthcare costs associated with drug use, while opioids are responsible for only 3.4%. So what we're getting at here is that if drugs weren't outlawed out of an interest in public health or their economic cost to society, what was the criteria then? Well, that, my friends, gets us into the drug war and drug prohibition. So the question is, why are some drugs legal and others illegal? The answer, sadly, is racism and colonialism. So the most important thing to understand is that drug prohibition was never about the drugs or public health. The drug war has been used to justify state-sanctioned surveillance, harassment, and violence against minority and poor communities. And also, these drug laws, importantly, could be selectively enforced to target these communities specifically. Media and government over the years have also promoted this by associating certain drugs with certain groups of people, even if it's not true. And there are multiple historical examples of this. So now I want to provide some examples. So the Indian Act, which prohibits the sale, purchase, and consumption of alcohol by indigenous people, still permitted European settlers to sell, purchase, and consume alcohol. So what this law did is it provided the government with justification to survey, harass, and incarcerate indigenous people for things that European settlers could still do. So it was selective. Similarly, the Opium Act of 1908 banned smokable opium, which at the time was primarily consumed by people of East Asian descent. But the law still permitted the use of opium-containing elixirs and tonics that were predominantly used by European settlers. So again, the law was constructed to target a particular population in society. So drug prohibition is also one of the key drivers of crime, overdose, and death in society. So when you make a drug illegal, but there is still a demand, organized crime such as gang, cartels, and mafias step in to meet the demand and make exuberant profits in the process. And because this is an illicit market, no organized crime syndicate can use the judiciary to settle business disputes in a court of law. So instead, they use violence to address any kind of business issues and to maintain their territory, hence driving crime. Drug prohibition has also created this unpredictable drug supply in which no one knows what's in the baggie that they're getting or how much is in there, which is why we're seeing so many overdoses. So drug prohibition drives organized crime to produce more potent drugs because they are easier to transport and smuggle, and then will yield greater profits once they reach their destination because they can simply then be diluted. So a good example is that we've had heroin around in the illicit market for 100 years or so. And there was a number of interdiction efforts being made to wipe out poppy fields, to search cars, boats, and airplanes coming across borders for heroin. And so the cartels in particular figured out that, well, we can synthesize these other high-power opioids, such as fentanyl and its analogs, in the lab, and we don't need poppy fields or anything like that, and it's much more potent, so we don't have to even get as much across the border to yield the same amount of profits and to meet the demand. Once law enforcement then shifted their focus on fentanyl and its precursors, we've started to see more of a shift now towards the production of another class of opioid called nitazene and its analogs. And so we're seeing more and more nitazines as fentanyl is cracked down on more and more. And this is something called the iron rule of prohibition, essentially saying that the more pressure you put on a product in an illicit market like this, such as fentanyl, something else is going to pop up to take its place to get around any kind of interdiction efforts that are being placed on the original drug, in this case, fentanyl. So we predict that we're going to start to see more and more nitazines as time goes on. Drug laws also disproportionately are enforced on minority communities. And this is true up until this day. So indigenous people are about 3.8% of the population, but comprise of 21.5% of the incarcerated population. So 5 times the amount, which is outrageous. Black Canadians also only make up 2.5% of the population, but comprise of 9% of federal prisoners, so 3 times their population. White Canadians, on the other hand, are 70% of the population, but only comprise of 53.7% of the incarcerated population, so less than their proportion in society. Much of this has to do with targeting, as people of all different races, classes, and ethnicities use drugs at about the same rate. So this is targeted. It's also important to understand that 55% of drug charges are simply for possession of these illicit drugs. Next, we're going to move to discuss harm reduction. So Harm reduction is a set of practical strategies and ideas aimed at reducing the negative consequences associated with drug use. It's an evidence-based philosophy of care that promotes a non-judgmental approach to working with people, for accepting them for who they are, and working collaboratively with them to meet their goals. Harm reduction is deeply entwined with other social justice, housing, healthcare, and criminal justice reform social movements. So, contrary to what many may think, is that we use harm reduction strategies every day. So, some common ones not associated with drug use are swimming, for instance. Going into a body of water is dangerous, but being able to swim reduces the chance of harm. Similarly, seatbelts and airbags are a harm reduction strategy. Driving is dangerous. Seatbelts and airbags reduce the chance of harm. And a more extreme example, just to prove a point, is parachutes. Jumping out of a plane is dangerous, and parachutes reduce the chance of harm. So one thing to take away from this is that just because an activity may be risky, we do not automatically ban it. Instead, we implement strategies to reduce potential harm. So some common harm reduction strategies for drug use include syringe exchange and safe sharp disposal. So distributing syringes and other injection equipment helps reduce the transmission of HIV, hepatitis C, and other infectious diseases. And having a safe sharp disposal available in the community reduces the amount of used needles in public places. Many also distribute safe smoking kits also to prevent the transmission of infectious disease. Condom distribution similarly reduces spread of infectious disease and unwanted pregnancies as well. Opioid agonist therapy, such as methadone and buprenorphine, helps stabilize people and reduce the chance of overdose. Similarly, safer supply strategies do the same. Drug checking services help identify the contents of drugs in the illicit supply that are unregulated and help inform the public about its contents, so that people can make an educated decision about what they're using and how much. Another tried and true method is supervised consumption sites that oversee the use of substances and can respond immediately in the event of an overdose, which prevents people from dying from overdose, as well as the need and cost of emergency services to respond to these overdoses in the community. So there's a number of benefits to harm reduction strategies. One is that it reduces overdose deaths, the spread of disease, injection drug use, substance use over time, drug litter, and public drug use. They also increase drug treatment initiation, access to primary care, as well as access to mental health care. Importantly, harm reduction strategies do not increase youth drug use, do not increase community drug use, do not increase crime, and do not increase public disorder. Additionally, harm reduction is also cost effective. It saves society's money. For instance, in Australia, it's estimated that every dollar invested saves up to $5.50. So it's financially conservative and responsible to invest in harm reduction strategies. So let's now review some of the foundations of harm reduction. One is that it accepts that people are going to continue to use legal and illegal drugs, and that the goal should be to reduce the harm as a result. Harm reduction also does not attempt to minimize or ignore the real and severe harms that can be caused by drug use. It also recognizes that drug use is a spectrum, and not all use is harmful, but also that not all drug use is safe. Harm reduction also works to reduce stigma associated with drug use, because as we've learned today, drugs were not made illegal due to the harms that they cause, but due to racism and colonialism. Harm reduction also prioritizes quality of life as a key measurement of drug policies and programs, not whether or not a person obtains abstinence. It's also very important to note that harm reduction is not opposed to abstinence and supports people who want to pursue it, but we also recognize that that is not everyone's goal. Harm reduction also views drug use as a public health issue, not a criminal or moral issue, and that's the approach we encourage governments to take when trying to address substance use. Harm reduction also recognizes that social determinants of health, such as poverty, racism, classism, colonialism, etc., make it more difficult for some people to reduce drug-related harms. Harm reduction also stresses that people who currently use drugs and previously used drugs should be involved in policy and program design as they have lived it. They have a good understanding of what works, what doesn't work, and how you can best support people. Harm reduction also accepts that behavioral change may be incremental, and we want to support people who are making any positive change to improve their situation, as the late Dan Big said. So in summary here, drugs are not legal or illegal due to the harm that they cause, but due to prejudice. Harm reduction is also more than just supply distribution, but a social justice strategy guided by radical acceptance of people for who they are, providing them with the necessary supports that they desire. Thank you all so much for listening to this presentation. If you have any questions, please feel free to reach out.